Today on Vital Insights.
We're also doing a lot of end-to-end virtual care solutions that I think we can talk more about in the future. And I know Early Sense is one of those, but we're also focused on FirstNet and our cybersecurity capabilities, which has become a huge focus for healthcare in the coming future.
Welcome to an episode of Vital Insights, a podcast series focused on thought leaders and healthcare providers who are working to transform the way we care for patients, now and in the future.
At CES 2022, the digital health conferences are buzzing with new virtual care technology, translated through the vantage point of a healthcare industry that has spent almost 2 years grappling with a global pandemic. Joining us today to talk about new technology solutions are three guests from the healthcare vertical at AT&T: Joe Drygas, Clara Hustad, and Clint Cetti. Joe and Clint, welcome back to Vital Insights. And Clara, thank you for joining us today.
Happy to be here.
Thanks for having us.
Absolutely. Always enjoy it.
A quick note for our Vitals Insights listeners. We are recording this episode during the Consumer Electronics Show, or CES, also known as the largest technology show in the world. But due to COVID complications across the board, the four of us are tuning in from different remote settings. That said, none of us has lost the spirit of innovation this week holds, as the world looks to Las Vegas for the latest and greatest in new technology innovation. So in some ways, I think of this show of CES as being like a fashion show. It sets the stage for kind of the wildest explorations into what we might see in technology for the coming year. So that said, Clara, I'm going to invite your response here. Could you tell us what people can expect to see from AT&T in the year to come?
Well, I can definitely say we have a lot of great stuff on the horizon. I think the number one focus, we have a lot of number one focuses, but one that I'm really happy to talk about is how 5G is really playing a role in healthcare. Unfortunately, we're not at CES, but we had really planned on showcasing a smart camera for inpatient monitoring. It would be able to detect fall prevention, allow for bed management. I know that shortages of staff is a big pain point for a lot of providers. And just to ensure the workload of the staff is minimized and the efficiency of the hospitals are maximized. So the video solution is connected to a 5G modem. It's part of a smart telemonitoring solution. We're also doing a lot of end-to-end virtual care solutions that I think we can talk more about in the future. And I know Early Sense is one of those, but we're also focused on FirstNet and our cybersecurity capabilities, which has become a huge focus for healthcare in the coming future.
Joe and Clint, is there anything you want to add to that? Anything we can expect to see from AT&T?
I think what we'll continue to get really energized about is the ability to enable all these really great innovations like Clara mentioned. And what we would have seen at CES and what is on display and showcased digitally are all these really cool, innovative ways to monitor and connect with patients virtually. And I think you'll see from AT&T that we'll continue to lead in collaborating with these different startups and really, really cool companies to enable them to go to market and to connect in secure and really efficient ways. And so I'm really excited about seeing where this goes and the opportunities that we have to really transform healthcare.
I love that. Anything else to add?
Yeah, I'll just say that overall, if I had to give a trend for 2022, for us, it's going to be helping our clients accelerate their digital transformation in healthcare, whether it be the scaling of endpoints and that connectivity to securing their scaled infrastructure and everywhere that their data is going to go and live. And then helping doctors and clinicians really just do the valuable part of their work and get rid of the noise and offload as much of that as we can. And to do that, it's going to require an acceleration of that digital transformation vision within each of our clients, and we can help them with that.
That's fantastic. As I think I've said to each of you in turn, there's so much that I want to unpack from each of your answers. And we could, I think, be on the phone for maybe a couple hours at a time. But I'll refocus myself and we'll get back to the questions. So one of the primary things that we've all discussed over the past several months together is the way the pandemic has really influenced and sped up various aspects of virtual care growth. I'd love to hear each of your perspectives on that. And Joe, we can start with you.
Yeah, Liz, you can talk to so many people who have never had a virtual interaction with a clinician pre-COVID. And so many of those individuals have had their first, and a lot of times would say, it actually worked pretty well. In fact, I kind of like this better than having to go to the traditional model and check in and wait and go see my clinician. So I think the pandemic for healthcare is going to just completely transform the way clinicians and patients interact. And the sky's the limit in terms of what's possible. And it'll definitely go beyond just virtual visits or what we traditionally have called telehealth. So I'm really excited about thinking about the possibilities for that interaction virtually, the ability for somebody with a chronic condition to have nurses and care coordinators watching over them around the clock. And then also the ability for family to be able to keep tabs on loved ones. I think I've shared before, in my situation, my parents live on the other end of the country. And so I'm always excited about thinking about the future of technology and how that's going to enable me to be able to keep tabs on my folks as they continue to age and their vitals. So I think the pandemic is really going to continue to accelerate the innovation and transformation in healthcare, and we're excited to be part of it.
Clara, what about you?
I definitely think that digitization within the hospitals is here to stay. And I unfortunately had to endure a 2-hour surgery, my husband's surgery, and the updates I was getting on my phone were pretty amazing. I'm not saying I went to them all, but I could have. With all of the updates I was getting, I knew exactly where he was in his patient journey. And I think that's something that patients and loved ones are going to start expecting in every part of the care continuum, from when they enter a hospital all the way till they get home. And they need to have that reassurance and be able to control and want to control a lot of the communication and dictate when that communication happens and on the platforms that they would like for it to happen. And I think AT&T provides that connectivity all the way through, whether it's Wi-Fi, mobility, or just direct connectivity within a hospital. So I'm excited for all the changes that are happening. And I think that's something that we wouldn't have experienced previous to the pandemic, which has accelerated that and continues to do so.
One of the things I really love that you just touched on is how healthcare providers are having to compete for patients. And alongside of that, they're trying to understand, how do we rip a page out of kind of the retail playbook, if you will, and look at experiences and how can we improve the experience. So I love that you just touched on your own patient experience but how that's being amplified and what we can expect to see there in the future. Clint, what about you?
Yeah, one of the things I love about the advent of virtual care is the equitable access potential that it has by integrating cellular into things like remote patient monitoring, so that they go with the actual medical devices when they're shipped out to the patient to be monitored at home. This is typically after they've done some kind of a telehealth visit or maybe gone into a clinic. But by cellular, by connectivity being integrated into the virtual care platform, it means that we don't expect you to already have broadband at your home. We don't expect you to be of a socioeconomic status to even afford that. And there's a billing mechanism to make sure that those things get cared for on the backside operationally and financially, but you don't have to worry about that. So while clinicians and hospitals and providers, they are competing for those existing patients, there's a whole set of population that typically had low access, whether it be in rural areas or lower socioeconomic areas, both rural and urban. And to make sure that cellular goes along with your healthcare means that it's becomes frictionless. And because of the great bandwidth and performance and coverage of networks like FirstNet and AT&T, it means it can also be enriching at the same time. So if you don't have to worry about access and it can be effortless and it's enriching, I think we'll see a greater adoption rate among some of the most costly multi-comorbidity or chronic population sets that we have really in the world. It's not just here in the US. So I think cellular is definitely an equity gap closure.
I love that. And I think the first time that you and I chatted, we talked about that. And I've gone on, just so you know, to evangelize that point.
Oh, good, good.
So moving on, when we look at kind of the major challenges of the future in remote care, scalability is a primary issue. And Clint, you just touched on this a little bit. Do you really feel that cellular is the answer? And if so, why? And Clara, let's start with you this time.
So I think the key factor in this is the ease of mobility. And that's, I think, why it would become the clear winner. When somebody has, a remote patient monitoring device and they have to tether it to Bluetooth or enable Wi-Fi on the device, a lot of patients don't understand or know how to do that. However, a lot of people have received a new cell phone over the past couple of years and they know how to just turn it on and it just magically works and your SIM is updated and you're sending and receiving information. And I think that's the beauty of cellular and why it will be the clear winner in terms of connectivity for these types of solutions and the ease of use of it.
Clint, what are your thoughts?
Yeah, along with that, I'll just keep going down the stream on it. Cellular comes with a lot of integrated security that you typically have to overlay onto Wi-Fi. So is that patient at home? What's the security level of their Wi-Fi network? What's the security level of any environment that they go into where they may need to transmit data over that? Cellular brings sort of that effortless experience of not just connectivity and performance and reliability, but also the security aspect that really providers spend a lot of money on trying to secure that multi-use network of Wi-Fi. And now that care will be nomadic to care for those remote patients so that medical devices can flow in and out of that ecosystem. Security is one of those things that they have to worry less about. It's still a priority, but when a lot of it comes integrated into the standard of cellular, especially 5G, it lowers the cost of the connectivity itself because you're not having to add licenses of different types of security products on top of it. We can still do that and still do that in those more complex environments for devices. But right now, it's going to lower the cost overall when you talk about the overlapping technologies that have to be added if you're not doing cellular. So I think it's going to end up being a game changer for a lot of the industry as we go forward.
And Joe?
Yeah, a lot of the startups that we've worked with in the remote patient monitoring space launched their products initially using Wi-Fi and find that it's not scalable for all the reasons mentioned. One of the biggest barriers is access and ease of use. And I'll go back to analogy I use a lot, but if you were to send a kit to my mother that required her to get it synced on her Wi-Fi network and then had to pair all these devices to it, she would just keep it in the box. And so it's really important for scalability to have an out-of-the-box, easy solution that is already connected to the network. And one of the ways that we've been able to differentiate how we offer our capabilities is by offering FirstNet, which provides even a further set of differentiation that provides even better access, even in rural areas, and prioritized access. So we believe that when you couple those things together, it really does help solve some of the challenges associated with lack of access and difficulty that some of these solutions have.
And that actually perfectly tees up my next question to you guys, which is accessibility and equity in healthcare are two other issues that the pandemic really brought to light. How is AT&T helping the healthcare system, providers, patients, payers address those?
Well, I think first recognizing that virtual care accessibility and value to that care is really linked to the patient's ability to engage in whatever medium of technology that the provider has chosen. So it's important for us as technology providers to minimize the effort required to engage with that digital health solution. And we have uniquely positioned ourselves with FirstNet, which is built by AT&T, but it is its own individual spectrum. I know a lot of our competitors out there say, "Oh, we have a fast lane." Well, at AT&T, we have our own highway. So the beauty of that network is that it's the only high-speed broadband communication platform that's built for first responders, as well as our public safety community, which includes EMS, doctors, nurses, and it was designed to support hospitals and emergency care teams. We're also looking into utilizing FirstNet and have been with remote patient monitoring. Rural health is a huge part of advancing in that equity. And in order to do so, we need to have connectivity, especially mobile connectivity, because it's easier to provide than hardwire services to the middle of nowhere. And, if you're a provider that has, a mobile healthcare cart that kind of rolls around, or an RV, we can enable that with FirstNet and help deploy those solutions. And I think that's our role. And it's something that's important to each and every one of us, as well as our company. But it's something we see a huge advantage in and can play a part.
I love that. That's fantastic. Joe, do you want to expand on that?
Yeah, we've had a lot of success working with tech companies and even providers to come up with cost-effective models in order to get connectivity and devices into the hands of patients that can't afford or don't have access. And so I think one of the roles that we'll continue to play is try to work, within boundaries. Fortunately, reimbursement has improved significantly in this area. And so a lot of times we'll sit down and try to figure out together, based on reimbursements, how can we put together a package with device and connectivity so that way we can kind of take that barrier off the table. So I think that's going to be a big part of our role. And we do believe, FirstNet giving us much better reach than what we've had traditionally is also going to be part of that answer.
And Clint, you want to round out the group?
Sure. I'll go over to the pharma side for a second. One of the things that got exposed during COVID was really when they looked at the data of the clinical trials, a huge population set of underrepresentation occurred in rural, the typical areas of rural and lower socioeconomic urban, specifically because they could not afford to have that technology sitting there at home to support the Wi-Fi clinical trial devices, or because they could not get to the physical locations in order to do it. Now that we actually are putting out a campaign right now with a lot of the pharma clients, so we're working with their clinical trial groups to start enabling a lot of those remote patient clinical trial kits to be connected with cellular so that we can get those people's data, that population data, into those data sets. And given that they have a tendency to have a higher propensity to a lot of the new diseases like COVID and some of the other cancers and stuff, even the FDA is considering that if it is successful to include those groups, and we get higher representation, that we could lower the overall number within the trial as long as we have better diversity in the population set. And they cannot achieve it without a technology like cellular that's integrated and goes along, as opposed to assuming that the trial participant has technology waiting to support the trial. So we're going to see a lot of benefit in clinical trial data just from cellular access, availability, and RPM solutions for those.
That's fantastic. Well, I'm gonna close us out today with one last question that gives us all a little bit of an accolade. So as you all know, we were thrilled to announce this year that our Early Sons Insight Plus system won a coveted innovation award this year at CES. And that is, of course, a solution powered by AT&T IoT. So do you feel moving into the future that we'll see increasing solutions like this collective one that we've worked on? And by that, I mean the blending of sensing and cellular technology. And Joe, let's start with you.
Absolutely. And really exciting announcement. I think it just shows what's possible when you take really cool innovation like what Early Sense did, and you pair it with connectivity from AT&T. So the two went hand in hand to create a really great solution. I think what we'll continue to see, Liz, is yes, we'll continue to see more and more innovative devices and ways to get vitals from patients. What's really cool about this one is it's in the background. The patient doesn't have to do anything, doesn't have to set up things, doesn't have to put things on her person. So I think we'll see more and more innovation in that way. I think the other thing we'll see is a lot of companies are making really great remote patient monitoring platforms. And these software platforms are going to want to integrate with these connected devices to build end-to-end solutions. So I think you're going to see partnerships between companies like Early Sense that make a really great device, and with AT&T to help connect that device, and then with RPM platforms that want to grab and aggregate the data and provide an end-to-end solution. So I think there's going to be really great partnerships, all in the spirit of transforming healthcare and making it easier for patients and clinicians to stay connected.
Clint, what about you?
Yeah, one of the things that we definitely have to stand on the gas on are that devices are more and more like Early Sense going to be a continuous monitor of multiple variables that then are correlated to bring about some type of a dashboarding or an intervention suggestion. And with all this data going back and forth to the cloud, we've already seen the healthcare industry mature enough to have the health fog layer, which sits between edge compute and cloud, to start looking at how much of that data has to go back and how much can it be reacted to now. The fact that the healthcare industry sees value in this continuous multivariable monitoring, like what Early Sense is putting out there, it really gives an indication to the maturity level of trying to be much more strategic and prepare for the future. And I think that what Early Sense has already put out there with the Plus platform is just really a textbook example of what we're going to see more of in a lot of different areas, where we're monitoring at a continuous level in your everyday life as the continuous patient, and as that term goes away, your vitals, and we act on it through AI and then more personable clinician interaction. So I just think it bodes well for the maturity level indications of healthcare as an industry alone.
And Clara?
The only thing I had to add was I think the beauty of your solution is not just the stages of sleep, the sleep scoring, the overnight breathing patterns, and all of the data that you're collecting, but that it's contactless. I think when people don't know it's there and it just works, and they can take hold of those metrics themselves, I think customers are going to start, and I'm calling them customers now and not patients, but once they know that they can get this data, it's going to be like, your smartwatch or a Fitbit. You have the data, you want to know the data, you want to keep track of that data. And I think that health is becoming very prevalent in our society today and very at the forefront. And so these types of solutions, especially yours, are going to be valuable, and those with the best dashboard and the best access to data are going to be amazing. So early sense in AT&T just works.
I couldn't agree more. I may be a little bit biased, but I couldn't agree more. And I love that you actually just called them consumers, because a patient never wants to be a patient. And that's one of the things that we've all talked about many times. So I love that you just took the leap and called them consumers. So that kind of wraps up my questions. Are there any additional thoughts you guys want to throw out as we're kind of closing out a week of new innovation at CES? And I can moderate here. Joe, would you like to, anything you want to add?
We're excited about the future, and really excited about how transformation's already taken place in the hospital and the home, and we're grateful to be part of it. And thank you, Liz. We really appreciate you moderating and bringing us together. It's been a lot of fun.
Clara?
Well, I just want to say thanks for having me. As a podcast newbie, this was really fun. But I will say AT&T is very focused on being the leader in digital healthcare. And I think our solutions, our network, and most importantly, our people really are going to make that happen in the new year. And I look forward to seeing how we get that all done and showcasing it, probably again on your podcast.
Fabulous. I look forward to that. And Clint, any last thoughts from you?
Hey, I couldn't have said it better. I mean, and to boil it all down, AT&T is ready to help you accelerate your digital transformation and improve outcomes in consumers. So it's a new day.
Excellent. Well, thank you all so much for joining us once again. And I look forward to having you all back again.
Thanks, Liz.
Thanks, Liz. Appreciate it.